Hemophilia. Hemophilia is usually an inherited bleeding disorder in which the blood does not clot properly. This can lead to spontaneous bleeding as well as bleeding following injuries and surgery. Thus, with a mild case of the disease may have symptoms only after an accident or during surgery. Blood contains many proteins called clotting factors that can help to stop bleeding. The severity of hemophilia that a person has is determined by the amount of factors in the blood. The lower the amount of the factors, the more likely is it that bleeding will occur, which can lead to serious health problems. As example, bleeding into a joint can result in permanent damage, while bleeding in the brain can result in long-term headache, seizures, or decreased level of consciousness. The majority of cases involve middle-aged or elderly people, or young women who recently given birth or are in the later stages of pregnancy. This condition often resolves with appropriate treatment.
What causes hemophilia? Hemophilia is a blood-related disease that caused by a mutation or changes in one of the genes that gives the instruction to make the clotting factor proteins needed to form blood clot. It's a defect in the gene that determines how the body makes factor 8, 9, or 11. These genes are located on the X chromosome, making hemophilia an X-linked recessive disease. A hemophiliac person mainly got the disease from their parents because it is an inherited genetic condition. Each person inherits 2 X chromosomes from their parents. Females have 2 X chromosomes, males have 1 X and 1 Y chromosome. Males can have a disease like hemophilia if they inherit an affected X chromosome that has a mutation in either the factor 8 or factor 9 gene. For a female to have hemophilia, both X chromosomes are affected, or one is affected and the other is missing or inactive. A female with one affected X chromosome is a carrier of hemophilia. Sometimes a female who is a carrier can have symptoms of hemophilia. In addition, she can pass the affected X chromosome with the clotting factor gene mutation onto her children.
After the explanation about what causes hemophilia, let us have a look on the signs and symptoms. One of the common signs of hemophilia is the bleeding into the joint. This can cause the swelling and pain in the joints, which are affecting the knees, elbows, and ankles of the patient. Other than that, bleeding into the skin is also one of the signs which will cause a buildup of the blood in the area and called as hematoma. Meanwhile, bleeding of the mouth and gum will also occur, that causing the patient suffer because this will be hard to stop, especially after losing a tooth. Besides, one of the most severe signs is the internal bleeding in the brain. A symptom of the brain bleeding can include headache, paralysis, and also vision problems. Blood can also be found in the patient's urine or stool for those who suffer from hemophilia, and the bleeding may arise from any part of the urinary system from the kidney to the bladder. Nose bleeding will be very common when it occurs in healthy person. However, it is problematic since this requires a long time to stop when this happens to those with hemophilia.
Next is the treatment of hemophilia, which is the replacement therapy, viral vectors, non-viral vectors, and genome editing. In this video, I will explain the most common treatment, which is the replacement therapy. Replacement therapy is the treatment by replacing the low or missing clotting factors into the patient's vein. There are 2 types of clotting factor treatments, which are the plasma-derived factor concentrates and the recombinant factor concentrates. The plasma-derived factor concentrates are made from human plasma protein. The blood is collected from people, screened, and tested for viruses. The plasma that collected from the people is separated into the clotting factors and other components. The clotting factor proteins then are tested and treated to kill the potential viruses and is packaged into the freeze-dried protein. The clotting factor proteins are then injected into the patient's vein. For the recombinant factor concentrates, they do not come from the human plasma as they are genetically engineered by using DNA technology. They are treated to remove the blood-borne viruses, so the hemophilia patients will not be infected by the blood-borne viruses when treated with recombinant factor concentrates. Hemlibra is a type of hemophilia treatment which replacing the function of factor VIII instead of replacing the missing clotting factor directly. This antibody is treated by injection under the patient's skin and can prevent and reduce the frequency of bleeding in the patients who suffer from hemophilia A. The coagulation factors which are made in the liver cells circulate in the bloodstream in an inactive form and then are bound to Von-Willebrand factors. The coagulation factors 8 are then separated from the Von-Willebrand factors when the blood vessels are damaged due to injuries. For desmopressin acetate, it is similar to the naturally occurring hormone in the body. It is treated through the veins or nasal spray. It helps to release the clotting factors 8 which are stored in the body cells and can increase the clotting factors 8 for the people with mild and moderate hemophilia A. When desmopressin acetate are taken by the hemophilia patients, about 2 to 5 folds of clotting factors will be increased in the blood.
Hemophilia diagnosis and prevention. Most people with hemophilia are diagnosed at an early age. Those with mild hemophilia may not be diagnosed until adulthood. Hemophilia can be diagnosed with blood tests to determine if the clotting factors are missing or at low level. If you are a carrier, the testing for hemophilia in your newborn usually occurs soon after birth. Some families want to request a prenatal testing. 3 ways to determine if you are a carrier. From the 3 clotting factor DNA test. How to prevent hemophilia? At this time, there is no way to prevent hemophilia. Someone who inherits a defective gene and those who produce too little clotting factor. However, we can prevent the bleeding. Prevention of bleeding. First, avoid trauma by adjusting their lifestyle. Contact sports should be avoided. Avoid use of drugs that affect platelet function. Regular exercise to promote strong muscle, protect joints. Thanks for watching. That's all for our group. Stay safe.